Welcome to the Royal Aberdeen Children's Hospital.
Good evening, Children's A&E.
Where every year more than 20,000 boys and girls from across the north of Scotland receive life-changing treatments.
We're going to take his appendix out.
There are tears and transformations.
You can have babies who are impossible to examine, you can have grumpy teenagers who just don't want to be here.
There is laughter.
Right, we're going to put it over here.
And moving moments. There is specialist care.
Yes, you are. You did really well.
Okay, bud, you did really well.
And cuddles.
If in a day I've made a difference to one child, then that's great. I'm going home happy.
This is the Children's Hospital.
Hi, you've had a bash to your head.
The Children's Hospital A&E department is open 24/7 and treats over 15,000 patients a year.
Bye.
And each one is greeted with a friendly face.
Bye.
10-year-old Harris has an injured left arm and has been brought into A&E by his mum and older brother.
I was doing snowboarding and I fell down and I landed on my arm, like next to my wrist. It's really painful, it's constantly throbbing.
Since Harris is in a bit of discomfort, Nurse Lauren will need to check his vital signs before she gives him any pain relief.
It won't be sore, but it might be a bit uncomfortable, okay? So the medicines that we've got, would you like to do the one that you drink first or the one that goes up your nose first?
I'll do the one that you drink first.
Right, okay. Right, if you just want to take that for me.
Just drink it.
Yeah, just drink it, it's fine. It shouldn't taste too horrible. Now when I spray, I need you to take a really deep breath in.
Okay.
1, 2, 3, deep breath in. 2, 3, deep breath in. You tell me if you feel funny, because that medication might make you feel a wee bit funny. Are you gonna sneeze? It's all right. There you go. It can do that sometimes.
You've been before here? You're regulars?
No.
And then it's off to X-ray with orthopaedic practitioner Andy.
Clara, no, you're fine. It's okay, you don't have to move it yourself. We've got it.
Radiographer Susan takes 2 X-rays so they'll have different views of Harris's arm.
Okay. I feel like you're a bit more upset than I am.
Sorry.
So he's broke it. So he's broke his radius.
That's his radius ulnar. And we put a wee star on it to let the doctors know
Just in case they can't tell.
that we've seen something that they should look at.
And the next view is going to be the more important view.
This is the side view that we did, and this is to check for the angulation of the fracture, how much angle's on it. So
The X-ray confirmed a broken radius, so it's back to Andy's plaster room to give Harris the news.
Can you see your arm?
Yeah,
That bit's not quite right, is it?
No,
It's a bit
it
bent.
doesn't look.
And then you see it on that one. These are normal, that's not quite normal.
okay.
So we're going to make it right.
Sorry, I'll hold you down.
It shouldn't be, mate. I'm just going to slide off. You can have some of this, mate.
Yeah.
So you just need to breathe in normally, okay?
To help ease the pain while the cast is applied, Harris is given some nitrous oxide, also known as laughing gas. And it seems to be doing the trick.
Flipping heck, mate. Is it that good?
See where it gets its name from.
Warm, mate,
Everywhere.
now.
It's just like a bit.
Is it good stuff?
Right, a little squeeze, mate. Okay.
Keep breathing.
Okay.
Big deep breath for me, Harris. Big deep breath. That's it. Well done. Keep breathing. Don't fall off the seat. That's it.
You alright, mate?
Remember to concentrate on your nose that you can't feel.
Nearly there, mate.
Keep breathing. Keep breathing on it. Harris, keep breathing, it'll make you feel better.
Harris needs to take deep breaths as Andy resets the bones in his arm.
Are we taking another picture? See what we've done.
What's up, nurse?
I was actually just partially asleep for half of that.
I think you've had enough. Had enough.
I'm not actually kidding.
Right, stand up then. Yeah, you got it.
Yeah.
I'm gonna let go.
Okay.
Ready?
Oh.
You keep nice and still, Toots, okay?
My thumbs.
Before Andy can finish the cast, they need to make sure the bone has been reset in the correct position.
I'm hoping to see it straight-ish. A few degrees of angulation will be acceptable.
Is that a good sign for you?
Oh yeah, it's a good sign. Yeah, we want to do it right, don't we? Right, looking good, mate.
Oh, excellent. It's like, it's looking straight, it's looking intact, which is, it's good. Well, it should be looking like that.
Okay, mate, right, so we're just going to complete your cast. So it's going to come to here, mate, okay?
Okay.
They probably will reduce it later on, but at the moment we'll just do that. Have you had some more gas?
What?
Have you sneaked some gas in? So we're probably looking at 4 weeks in this cast, and then 2 weeks in a blow elbow.
It's better, like, no more throbbing. There might just be like the tiny bit of pain, but that's expected. Unfortunately, I won't be able to do swimming, and even worse, I was having an upcoming piano exam that I will no longer be able to do. Also, no more rugby either.
A few hours after his snowboarding accident, Harris's arm is now on the mend. But he'll be waiting a while before he's able to get back to his hobbies. Harris will be back in a week to see the orthopaedic team. There are 5 orthopaedic consultants at the Children's Hospital who treat disorders of the bones, joints, ligaments, tendons and muscles. 14-year-old Ewan has a condition which causes growths on his bones. And he's no stranger to the orthopaedic team at the Children's Hospital. This is the 5th time he's had to have surgery to remove some of these bony lumps.
It's like acute multiple exotoses. Yeah, I don't know much about it, but that's what it is.
Exotoses are benign growths on the surface of the bone. They need to be removed if they're causing pain or discomfort. Yesterday, orthopaedic surgeon Miss Mills cut out lumps of bone from Ewan's right shoulder and left knee. Ewan's body should stop producing bony lumps once he finishes growing.
The scapula here hits it a lot, so he's having a lot of problems at school with writing and positioning because he's getting shoulder pain because of this lump of bone that he's got there.
My shoulder is rubbing against my shoulder blade, so whenever I was like leaning down in class, I'd always get a really sore shoulder, and this one was just a really big bump, so I need to get taken out. You can see it through my jeans and joggers.
So this lump here is bothering him, in particular when he's doing sports, it's catching on the muscle.
I know.
So our plan is to remove this one. It will probably take about half an hour to remove this lump. Is it 6 centimetres, maybe 7? But his actual bone is right at the bottom of my forceps down here. Ewan had his operation yesterday afternoon, so he'll just be waking up this morning. The first thing will be to see how painful he is, and then the second thing will be to get him up with a physiotherapist. But he'll be quite keen to get home. He doesn't like staying in hospital at all.
I do prefer home than the hospital. Yeah, I prefer my own bed, but it's not very good at night because it's hard to sleep when you can't like turn over because of your knee. So nights tend to be the worst part, but it's good. They could do some Wi-Fi, but it's good.
Are you feeling comfortable this morning?
Not really, my shoulder is a bit sore.
Are you able to lean forward a wee bit? Let's have a look at your back. It's looking absolutely fine.
Yeah, it wasn't sore last night, but now it is.
Okay. The reason for that is because we put local anaesthetic in to the wound. Yeah. Okay, so it'll just have worn off a bit. Okay. How's your shoulder movement? Do you feel as though you can move your arm a bit?
A lot more than I expected, but it's a bit sore now.
Okay. Good. And can you go forward much with it? Can you go up in the air? It's a bit sore. Okay, don't worry about it. And let's have a look at your knee on the other side.
I think I can walk now. Like,
You think you can walk now? Brilliant. Okay. Are you able to bend your knee at all? Lovely. And can you straighten it? Fabulous. Okay. Because he had his right shoulder and his left knee operated on, the challenge will be whether he's able to use crutches or not. So we'll see.
Ewan won't be allowed home until he can walk safely. And it's up to physiotherapist Nina to assess if he's mobile enough to be discharged.
Take your time coming up. Over. Okay, because you've been lying in bed, we just want you to sit there for a minute just to get your head settled. We're not going to do this quickly, okay? I know you're keen to get going. So let's try and pop this slipper on. So what we're going to do is we're going to stand you up, okay? And I'm going to give you a little bit of help, okay? And when you stand up, I just want you to stand there and not try and move anywhere. You're gonna feel a bit wobbly, okay?
Okay. I don't think I actually would need crutches.
Yeah, so that's why we're gonna stand up. And what I want you to do is practice taking a wee bit of weight through your left leg, just on the spot, just sway to the side. And then can you sway to the right side? And then over to the left side. Try and relax your arms. Good, how does that feel?
Yeah, it feels good.
Feels okay? Right. Now can you relax this left arm? How are you feeling?
Yeah, I'm feeling good.
Are you sure?
Yeah.
You let me know straight away if you're
No,
feeling...
It's not sore, it's not sore.
Good, and can you relax that right arm?
Nah, it's a bit sore.
It's a bit sore. Well done. So what we'll do is if you stand up first, okay? And then pop the crutch in. Now we'll see how you feel because we all obviously...
Oh, I hurt my knee there.
Okay. It's okay. Take a wee step back so you can feel the bed behind you.
Oh, that hurt.
And have a seat. Okay. Now this is the reason that we probably need crutches. I think you're really good on your feet, but obviously you're quite sore now that you've been up and done a few steps.
Yeah, I think I just pulled the stitches. Cause,
Remember your knee's going to be swollen, so it's going to feel a bit different to normal. Okay. He did really well for his first attempt. Often we'll just do a little walk first, see how they go, and then come back and do stairs later on, just for safety as well.
For now, it's back to bed for Ewan. He's not getting to go home just yet. Over in the medical ward, 7-year-old Daniel has arrived for his surgery. It's part of his ongoing treatment for leukemia. He was diagnosed 2 years ago and has been in treatment ever since.
He was diagnosed with acute lymphoblastic leukemia. It was just after his 5th birthday. He comes in every 3 months for this chemo by lumbar puncture. Every month he comes in for chemo through his Hickman line, and he gets oral chemo every day at home through his gastrostomy tube. Today he's coming in for his intrathecal chemo, lumbar puncture, and he'll be getting his gastrostomy tube changed because he's had it in for nearly 2 years now.
Being treated for cancer is not the only challenge facing Daniel and his family every day.
Daniel was diagnosed with autism when he was 2. He's severely autistic, non-verbal. He's got some photographs on his iPad, things like feathers, juice, cookies, so he'll flick into the photographs and show you what he wants as well. He likes to play with feathers, he likes to watch them blown in the wind, bubbles, going to the park, just anywhere outside. Daniel loves to be outside.
Daniel will undergo 2 procedures today, but first Dr. Zoe comes to check on him.
Can I tickle your tummy?
Yeah.
You're so flexible,
I know.
Daniel. So flexible. Can I have a wee tickle in here?
Don't like
these. Do you want to hold that in front?
Yeah.
Yeah, let's
Have a
do
feel
that.
of your belly.
Is it tickly? Oh, you got a tickly belly. Well done.
Boy.
I'll have just a wee quick peek. Looks pretty good, doesn't it? Well done.
As well as receiving his regular chemo, Daniel will also have his gastrostomy tube changed today. It's a tube which delivers medicine and food straight into his stomach.
His gastrostomy tube, we use that for his oral chemo. any medicines he's got to get. And since he started treatment, he sometimes won't eat, so he gets fed through his gastrostomy tube as well as a medicine. I just think it's nae fair with autism as well, and then for him to get cancer on top of that. Children didn't understand anyway, but you cannot explain to him why he's coming here and what's happening.
Before leaving his room, Daniel is given a pre-med to make him sleepy. Then it's off to theatre for a general anaesthetic. Once he's asleep, the chemo treatment begins. A needle is inserted to deliver drugs straight to Daniel's cerebrospinal fluid.
That's called a lumbar puncture, and we were giving something called intrathecal chemotherapy, so chemotherapy drugs that go straight into the spinal fluid in the back. We give the chemotherapy into the spinal fluid itself if there's any concern that the cancer cells might have spread to the spinal fluid, right in the fluid that surrounds the brain, and we just give it directly into that fluid rather than through the veins like we do with some of the other chemotherapies.
With the lumbar puncture completed and the chemo administered, it's time for paediatric surgeon Mrs. Winter to replace the gastrostomy tube.
Daniel has a tube that goes into his stomach that allows him to have nutrition, food placed through that, and also medications. He has a very small, thin tube in, so today as he's got bigger, he needs really a bigger tube to prevent it from blocking. Grand. Okay, so now cut it flush up here. We've repassed a new tube, which will last him for months, potentially years. Okay, so sign out, replacement of gastrostomy. Back to the ward, he can start using his gastrostomy.
Chemo administered and gastrostomy tube successfully changed. Daniel is moved through to post-op recovery, where he'll be monitored until he comes round from the anaesthetic.
So we're just going to keep him here at the moment until his saturation levels come up. And we're happy to send him back. But in the meantime, we'll just keep him on oxygen and just see how he gets on.
He's been through 2 years of treatment now, so he's still got another year left to go. He finishes treatment in October the 19th, 2019.
Hi, it's Fiona from Recovery. It's just to let you know if you can pass on a message to Mum. Daniel's absolutely fine. He's been in recovery for a wee while now, but he's very, very sleepy.
Your mummy wants to say hi to you.
A while later, Mum is allowed into recovery to see Daniel wake up after his operation. From now on, Daniel will be fed through his new gastrostomy tube. In the hospital, each of these feeds is individually prescribed and made up by one of the healthcare support workers. Today, it's Michelle's turn to make the feeds.
We're going to wait to make the milk feeds for the whole of the hospital, including a neonatal unit. It's like a prescription feed, and basically you need to follow the prescription that's written up for them. This is where prescription charts here, and this is all the special feeds that we use for every individual patient. So we've got quite a lot of feeds today. There's actually 11 to be made, an hour 45 minutes to do the 11 feeds. We do their feeds for 24 hours, so usually we try and get them done at 3 o'clock every day. There's quite a lot of feeds for kids with disabilities and kids that haven't got good appetites, and they get maybe topped up by a milk feed. So it really varies in age from like babies up until maybe 15, 16. Now that I've made up this feed, we have to label them all, and it's the expiry date and the time that they were made, so we know that they're only lasting for 24 hours. My job title is a healthcare support worker. So basically I do cleaning, washing the kids, bathing, showering, lunches, breakfast, teas, a bit of everything really. It's challenging. Everybody says, how do you get through your day? Because there obviously is a lot of sad cases as well. My way to get through my day is I just treat people how I would want me and my family to be treated. And I think that helps you just get through your day at work. I was actually a hairdresser for many, many years. I decided that I would like a change and this is what I chose. And I've never looked back. I don't do hair at all now. I just love working here.
And just as happy at work as Michelle is speech and language therapist Sue Ann.
I love working at the Children's Hospital because my age range of patients is from 0, the newborn babies in the neonatal unit, looking at their eating, drinking and swallowing difficulties. That's an aspect that people aren't often aware that speech and language therapists get involved with, is assessing the safety of the swallow. So we'll be seeing tiny babies and then right up to the age range of 16. So there's a huge variety of age range and also conditions that you see, and every day is different when you come into work.
4-week-old baby Lewis has come in today with a suspected lip tie, where a thick piece of skin connects the lip to the upper gum. It can lead to difficulty feeding.
So do you want to tell me a bit about his very early feeding from sort of very beginning? Did you try to breastfeed at all?
I did try, but he just didn't latch on. So and he gets very distressed when you do try to. When you feed, he's actually feeding fine, he's like very, very splotchy with it.
Today, Sue Ann is going to check for both lip tie and tongue tie. In severe cases, this skin will need cut to release the tie. But baby Lewis seems happy to sleep through the checkup.
So what I want you to do is put him so that his legs are facing your tummy and his head's coming, if you just put your hands together, so that his head's sort of coming over backwards. So I'm just going to have a wee look at this. My opinion. See, it's a nice tummy, isn't it? This is, I know, now you're waking up. As you can see how it's coming right up over onto his nose. So yes, although you can see that piece of skin quite clearly, he's able to lift his lip right under. So yeah, so although you can see the frenulum underneath the tongue there as well, you can see it's still moving quite nicely. Everybody does have one of those, it's just when they're tied that the tongue gets restricted. But that seems to be good. Feel this way? Yeah. Okay, Toots.
The next step is to see how Lewis handles a feed. But so far, he has no interest in waking up. Not even a wee tickle of his toes can persuade him.
Usually our babies are a little bit more accommodating than that and are often desperate for a feed, so there was a lot of having to go on what I was seeing inside his mouth and parents reporting around feeding.
Come on,
I'm just not ready. I wasn't ready.
I'm ready to feed. What are you doing? I couldn't leave you any longer this morning because you were.
No,
he was hungry.
No, we wouldn't want you to. And I think actually there's quite good range with his tongue, so I don't think I would be wanting to get anything done.
Having checked both his lips and tongue, Sue Ann is happy with the movement in his mouth. Lewis won't need any operations.
So have you got any other questions at all?
No, I don't think so. You don't, do you? I
just want to be left in peace.
It's like, oh, I've just got an extra feed there.
He's gorgeous.
Thank you.
Thank you for coming in.
That's Mum and Dad reassured that there's no cause for concern, and Lewis can get back to napping in peace. Back on the surgical ward, 14-year-old Ewan is still recovering from surgery to remove bony growths from his shoulder and knee. Earlier today, physiotherapist Nina got him walking for the first time after his operation, but he was in too much pain to be sent home. He's been left to rest up for a couple of hours, but now Nina's back. If he can get up and about, Ewan will be allowed to go home.
Hello again.
Hello.
How are you?
I'm doing well, yeah.
Doing well? Will we try the stairs?
Yeah.
Yeah? What are you thinking about the crutches?
I'll try without them.
Try without them?
Yeah.
Have you been up since I saw you before
No.
lunch? You've not been up?
I've been sleeping.
Just take a wee minute.
Oh, my shoulder hurts more than anything.
Your shoulder. Practice taking a wee bit of weight through each leg.
It actually is a lot easier this time.
Yeah, you look a lot better already. And you're getting a bit more of a
To be honest, I
bend.
do just want to go home. I'm just kidding.
I know. So it's the big test. If you pass the stairs test, then we'll give you a big tick and you can head home.
Thank you.
Right, so you show me how it's done. Good. Do you think you'll be able to use the rail with this sore arm?
Yeah.
Yeah? Okay. That's really good.
It's never been this easy.
Is this the easiest it's ever been?
Yeah.
Do you play any sports? What's your-
Football.
You play football?
Yeah.
Okay, we're going back
Going
down.
down, so it's scary.
Just with the right arm. Nope.
I've went forward in my...
Okay, so this arm needs to be on this rail, because we're not going up there, are we?
Yeah.
Yep, and then that was right, so down. So do you prefer to go sideways?
Yeah, I do.
Is this how you normally do it?
Because I don't bend it. I'm feeling the shoulder.
Feeling it a bit in the shoulder. Have you done stairs with a crutch before?
Yeah.
And I think you look nice and steady and safe there. Yep. Well done. Good stuff. Right, do you want a wee seat again before we go back, or are you feeling okay?
No, it's fine, it's fine.
Right, we'll just head back through.
Okay.
Ewan's proved he can walk and tackle stairs, and he's in much less pain than this morning.
I'm absolutely happy for you to go home, so
Okay, thank you.
I'll let the nurses know that you're nice and safe on your feet. So that's it, you don't need to see me again.
Yeah, thank you very much for
You're
everything.
very welcome. You've done really well. And hopefully we won't see you anytime soon. In a good way.
Yeah, thank you.
You're welcome. See you later.
See ya. I'm happy. I didn't really know how sore my leg would be coming into surgery, but I'm happy with it. It's a lot less painful than I expected.
He's a lot better after lunch. I think he's keen to get home, so he did really well. He was really safe and fine, and he's been in here quite a few times and worked with us and had to do that before, so he's well used to it.
There's still the paperwork to do, but Ewan can't wait to be discharged.
It does take a while, but I'll be home soon to play Xbox.